next session is by Mr. Sukhad Kulkarni. He has got over 27 years of experience and he comes from a core engineering background. He has worked with Bharat, Ericsson, Tata, Siemens and is now leading Ernst & Young as a director advisory. When we were interacting with Mr. Kulkarni, he told us one interesting fact that most of the business leaders spend nearly 30 days a year in the air by flying. And he has more than 100 boarding passes collected. So the delegates from the hospital vertical will be quite eager to hear on how technology can help bridging the patient centricity and the stakeholders' expectations. We welcome you, sir.
Thank you for the nice introduction. First and foremost, thanks Vichy and the team for this really beautiful event, and it's really a great pride to be part of the group and representing multiple organizations, firms, hospitals, and many other institutions. So before I get into my presentation and before I just start talking about what is there on my agenda, I just wanted to understand a little bit about the audience. So, I'm basically not a doctor, and I come from the advisory consulting background. So how many of the people over here who are basically handling the information technology or the back office functions like finance, like inventory, like procurement, like sourcing and all those things? Just a wild guess. Okay, great. Great. So is in India, and we are talking about a lot of growth, a lot of things happening in terms of technology, in terms of investment, in terms of government supporting the overall healthcare sector, in terms of launching new schemes, and exactly. So what is actually the opportunity size when we talk about the opportunity? What exactly is a quantification of that opportunity, and where we stand, and how we can leverage those opportunities what we have? Secondly, when we talk about the opportunities there in the platter, how are we going to leverage it? Are we asking the right questions to ourselves? Are we identifying the right stakeholders? And are we really identifying the needs of these stakeholders? And are we aligning really ourselves with what our stakeholders want? And when I call stakeholders, it is the entire end-to-end stakeholders, right from the consumers to the doctors to the investors, to the suppliers, to the vendors, and the entire ecosystem in a whole. And when we say that we are undergoing a lot of change, and there is a change that is there in everything, may it be a primary care center, may it be a secondary care, may it be a tertiary care, may it be the backbone operations like financial accounting or sourcing or the inventory. So what is that change we are really experiencing, and are we responding to that change in a timely manner so that we do not miss the bus? So to talk about the opportunity, if we are really talk about, what is the size of the opportunity? The size, if you really look at the figures, it's really humongous. We are talking about 20 to 25% growth in medical tourism itself. Medical tourism has been one of the most profit-making and money-fetching business. The government of India expenditure on health sector has grown by 0.2% to 1.4%, and on the public health spending is going to be nearly 2.5% of the country's GDP by 2025. The fourth point, I would say, the most lucrative one for all the people working in this sector is the FDI worth 5.25 billion has been invested in the country so far, and we are experiencing a lot of investments that are there in the pipeline. And not going to each and every figures, but we are seeing that the hospital industry in India is forecasted to increase to 8.6 trillion rupees, or 132, 132.84 billion by FY 2020. So I think with the CAGR of 16 to 70% of increase, I think it's a big opportunity. It's a huge opportunity. Uh, Coming to some more statistics, as some of the figures may repeat, but what is essential is the number of doctors that are going to be available in the sector, and the hospital industry growth with the CAGR of 16 to 17% to reach to 8.6 trillion INR. I think that's a very big opportunity. So having said all these numbers, and all these numbers are publicly available. I mean, it's not something which is a very trade secret. All these numbers are available, and all these numbers are really good and encouraging for the people working in these sectors. So are we asking the right questions when we see the patient centricity? So when I talk about a common consumer, any common consumer like me or any one of us, he asked these questions: that the services which I need, are they available? Are they accessible? And are they affordable? So when we are talking about the availability, accessibility, and affordability as very common questions of the consumers or the common patients, when it comes to availability, as healthcare professionals, may it be working as the practitioners, or may it be working as doctors, or may it be working as the back office, or the finance or procurement or sourcing person, do I have the right facilities and resources available, first and foremost? Secondly, are they efficient enough? Are they productive enough to deliver the demand? When I say demand, it is right from the primary to secondary to tertiary care. So are the facilities, are the equipments, are the resources that are there, are they available? And how do I really measure and continuously improve the availability, quality, and performance of the resources? Because unless and until I do not have the right kind of availability and the right kind of performance delivered, um, I don't think just keeping them available is going to make any help. Coming to the accessibility, I may have the state-of-art facility available with me in my clinic or in my hospital or in my lab. How the people are able to access, how the consumer like me, are there any good accessing tools? Is there an efficient app? Is there an efficient IVR? Is there an efficient website? How can I quickly register? How can I have a very user-friendly system by which I am able to access uh, the right kind of facility where I would like to go and I would like to avail this service? And having the facilities, having the resources, making available and accessible, am I able to deliver my services in an affordable way? All these availability, accessibility, and affordability are interwoven. They're dependent on each other. If I am able to maximize my reach to the needy, if I am able to maximize my reach to the last person who is going to seek that service, and if I am able to align very well with the socio-economic parameters, may it be the different schemes, may it be different uh, geographical constraints, am I able to deliver my services in efficient and productive way? And how am I continuously taking measures to do something more in less? How am I able to do something more in whatever is available? And finally, how am I able to optimize my cost of resources so that it could be made available to the consumer in a very cost-effective way? So when I ask these particular right questions, obviously, we ourselves identify that we have to undergo a lot of change, and it's a continuous change. It's not a one-time change. And when I see change, a very big change, what we envisage as a common consumer as well as the professional into our spectrum of the advisory work is the increasing corporatization. When I say corporatization, uh, There are corporate management ways and means that are coming into picture. People are more and more conscious about what they want to spend, what they want to invest. People are more conscious about the ROI. People are more conscious about efficiencies. People are more conscious about productivities. People are more conscious about ratio analysis and different kind of analysis to make sure that the money invested is being used in the most efficient way. Digitalization and investor expectations and obviously the growth of the provide care industry is becoming more and more more and more demanding. I would like to go to the last point, skipping the first 2 or 3 points. Particularly, I would like to ask, the people who are managing finance or managing the operations apart from the clinical operations. So, how many of you are? Uh, how many of you can say that my GST rollout was very, very smooth? I think many of us struggled when the GST was launched and the GST compliances were there. All of us struggled because we were not ready for that change. We were not prepared for that change. The awareness itself was on a very, very lower side. That's the disruption we faced. The second thing which is launched from this financial year, how many of you are aware of something called as IFRS 16 or India Accounting Standard 16? Anybody of you? So just to give a very high level indication that the India Accounting Standard 16 or IFRS 16 is going to demand the operating leases to be part of your balance sheet. The finance people will understand it very quickly. So earlier, whatever movable or non-movable assets which the hospitals or clinics or the provider care firms had, maybe in terms of land, maybe in terms of building, maybe your pathology equipments, lab equipments, or the other equipments, whichever there were on lease, those now have to be part of your fixed asset register. Earlier, what you used to do is you used to just, post the expenses into your P&L account and just forget it. But now it is not going to be that easy. All your operating leases have to be part of your FAR. You have to calculate the PV or the present value, and you have to post the interest, and you have to post the necessary entries into your balance sheet. And this is going to be applicable for all corporate hospitals from this financial year onwards. Now, this is a big change. And similarly, many of such changes are going to come. Obviously, the trust or the mission hospitals are currently out of that, but some kind of standards would be applicable for that as well. So all these statutory changes are going to demand very robust systems in the background. People used to have a very entry level or a very smaller local focused systems for managing the back office operations, but it's not going to be very easy to manage all such kind of statutory changes or the controls what are going to come into picture. Many of the people are making compulsory audit of the IFC or the internal finance controls. And the investors and the auditors are going to be more and more demanding when it comes to the IFC or the internal finance controls. So there is a lot of struggle, and therefore there is a need for change, because what we have witnessed in this industry is there is a disparate data structure. There is a disparate process structure. All the processes for your financial accounting, managerial accounting, asset accounting, your human capital, your procurement, vendor management, sourcing, inventory management, all are disintegrated. You do not have one common robust system in the back office which supports the non-clinical operations, and forward integration is there with the clinical services what you offer to the consumers. EY, as you must be aware of, as one of the big four big four firm globally in consulting and advisory, conducted a health survey. So this is again this survey is available on the public domain on the website of EY, and this survey was conducted in US. So there were some interesting findings that have come up out of this survey. So there is an opportunity and there is a challenge of increasing life expectancy. And people are more and more demanding in terms of the healthcare needs. And people are expecting or demanding a lot of change and improvement into the patient and doctor interaction, patient and healthcare firm interaction. People are more and more interested in going digital. People are more and more interested in availing these services where the best services are available, perhaps not even visiting to the healthcare service provider. So most of telemedicine or a teleradiology or a teleconsulting kind of things are getting encouraged. Secondly, from the caregivers or the doctor's standpoint, the hospitals or the provider care firms are increasingly facing challenges of having the right kind of doctors or the right kind of practitioners being associated with them. The incentives do matter. Incentives and uh, the retainer fees definitely do matter. And uh, earlier there used to be a great sensitivity about data and great secrecy about the data. And people now are open to share the healthcare data, or people are now open to share the clinical data more and more for the benefit of people, for research, or perhaps to get the right kind of treatment in a most cost-effective way. So you can visit this link, and there are 4 or 5 documents which are there available on this link. And it's interesting to see how the healthcare in US is shaping up. Um, I was talking in the beginning of my speech that we need to identify all our stakeholders and really weave the entire vision and objectives and the success themes around every stakeholder. So basically, it's a collaborative world. It's an ecosystem. So how do I improve my consumer collaboration? How do I improve my TPA collaboration? How do I improve my doctor collaboration, employee collaboration, supplier collaboration, and investor collaboration? So there are certain success themes which we commonly come across with all our clients and all our associates. Is we definitely need the process benchmarking, process standardization, and define the key performance indicators for each of the element of the entire ecosystem. May it be your financial ratios, something like asset to turnover ratio, or something like inventory turnover ratio, or maybe ABC analysis, or certain ratios which are the combination of your clinical and non-clinical services, something like per bed revenue, per patient revenue, per location revenue, the specialty-wise P&L, specialty-wise profitability, and certain clinical ratios predominantly guided by the NAVH guidelines, the acute surgeries or the readmissions or the incidents or those kind of things. So how do I benchmark my processes? How do I standardize my processes so that when my organization is growing, when I acquire a new facility or when I start a new facility, how a seamless experience is transferred from one location to another, from one center to another, from one branch to another. Second is the level of interaction. People are not really interested now to have a face-to-face meeting or really taking time on a face-to-face meeting. So the interaction has to be faster, it has to be better, it has to be available anytime, anywhere, on any device. That's what the expectation coming around. The productivity and efficiency of all my resources, may it be financial resources or may it be non-financial resources, human resources or non-human resources, it have to be improved on a continuous basis. Reduce cost, improve quality, and maximize the reach of my services. That's the basic theme. Last and not the least, when we employ a technology, may it be a HIS system, may it be the PACS system, may it be a backbone ERP system, whatever technology is being deployed for the entire process management or a point solution, how do we unlock the business value out of that solution rather than coming out as a very trivial or a transactional analysis? So it's a world of digital and a digital era. So go digital is what we are really talking about. So coming to the final part of my presentation, as we say that this is something how we help our clients and help our particular healthcare clients, how we set the strategic objectives, expansion, growth, efficiencies, brand value. How do we define the metrics, the revenue and operating margins, quality and compliances, etc. And coming to the exact drivers and KPIs, might be the financial drivers, financial KPIs, quality and compliance related KPIs, operational and operational efficiency compliances. So these are the drivers and KPIs which typically are required to be set and continuously visible in a real-time fashion on any device of the management. Maybe the CFO needs to have on his tablet or on his mobile whatever are these financial KPIs is there. Your CMO need to have the compliance and the operational parameters on his tablet. So this calls for a very hybrid kind of a landscape. The financials, the operations, and human capitals being the main pillars need to have a good ERP backbone. You need to have a good operational ops like HIS, PACS, and other things. The common elements of organization structure have to be controlled by a backbone ERP system. The entire organizational master data has to be controlled by a very strong ERP backbone system, whereas the front office systems have to be used only for transactions, and those have to be integrated into the ERP. And this entire technology landscape has to form a single source of truth, what we talk about in our language. And on top of it, we can build a lot of automation, we can build mobility solution, we can build artificial intelligence, we can build bots, machine learning, analytics, and a lot of other solutions. So underneath, what lies beneath is a very strong ERP backbone to control financials, operations, and human capital, a very strong operational apps to control your transactions like billing, patient administration, and all those things. So there are a couple of slides which I do not want to go into much of detailing of this entire solution map, or something which probably I can take offline with the interested people. It might become too technical. With here, I would like to pause my presentation as such and open to questions.
Good information, sir.
Thank you, sir.
I would like to ask you, one, while comparing the whole scheme with what is happening in commercial circles like Amazon or Uber, you have all facilities available, but the distribution depends on the information dissemination to the lowest level. That's what, without any infrastructure, Amazon and Uber does that.
Absolutely.
So, is there any system or app that's going to develop to inform at panchayat level or at e-seva level for anybody? For a primary, for example, for any primary healthcare system can look after 60% of the diseases. Rest will be discussed to specialist hospital. Instead of a guy running for a common symptom to a specialty hospital and increasing their workload and paying more. So distribution becomes cockeyed when the information is not disseminated properly. Is there any app that's going to happen to give the information to the patients where to go at lowest level?
So I may not be able to prescribe any app as such. Probably it would require some kind of an evaluation of few systems, because the need actually has to be defined in a little detailed manner. There are a few good systems and apps which we have come across, but I would not like to call them that they are meeting the needs in an entire way or in an end-to-end process way. But I would say that with a little customization or with a little enhancements, there are systems which can be made available, I believe. I may not be able to say the exact name of the app or the system at this particular point of time, but definitely we can look forward to. Just to give you an example, a highly customized system. I have seen in one of the very big hospitals in Bangalore for IoT utilization. So they have, so what I heard is the prematured born babies, so it's basically for the home care kind of a treatment. So the prematured born babies and mothers are actually there at their houses with the sensors installed, and there is a control room in the hospital, and there is a caretaker, which is there at their house, and the parameters are continuously being monitored into the control room, and if any parameter, slips beyond the limit, the control room person directly gives the call to that particular doctor, and he prescribes that you have to do this procedure, or you have to give this injection, or if it is too critical, bring them to the hospital or something. So this is one example, not very relevant or very same as what you are talking about, but certainly there are systems and applications which have been developed for that. Maybe we can, in terms of product support and everything. So there is a large adoption.
Yeah, the reason I asked this question is we are a US-based company, so everything is transparent there. But here, the system is different, so that was the reason I asked. And the other question is, in the current applications, what do you see means, like what is the percentage of applications are there available to whatever the vision you have? Do you see any applications, health applications already there in the market with your vision? That is really perfect system, whatever you are envisioning.
I had a slide explaining that, which I did not take because of the lack of time. Is my laptop still connected, or it is removed? Okay. Maybe we can take that offline.
Sure.
So there is a detailed solution map which I had a slide, but it is too technical, so I did not get into that.
Okay.
But the entire application landscape, which application does what, and how the data flows, and what is the strength of each application, and how to capitalize on the strength of each application to deliver the ultimate expectation of the stakeholders. I had that slide, but it was too technical, so I skipped that.
Okay.
Maybe we can talk offline.
Yeah, sure. Yeah. Thank you so much.
Oh, thank you so much, sir.
Thank you.
I think most of you guys, we wanted to celebrate it, but the cake is on the way, sir. We will be celebrating it in the lunch session. But
Thank you.
for now, I think we can sing a song for sir. Yes?
Thank you so much. Thank you.
So, 1 second, sir.
So if there are any further questions, I think we can touch base offline.
Yeah.
And
Yes.
thank you.
Happy birthday to you. Happy birthday, dear sir.
Thank you for the great
Happy
gesture.
birthday to you.
Thank you for the gesture. I never expected that.
So please speak up. I would request Usha ma'am, Head of Medical Affairs at Infocus RX, to present the mementos to sir.
Oh, thank you so much. Thank you so much. Thank you so much. Thank you so much.